Welcome to this informative edition of Remedies. This is founded and hosted by a beautiful doctor by the name of Dr. Asma Qureshi. Dr. Qureshi always provides $1 million advice on and about health issues. On this good Saturday morning, Dr. Qureshi will educate us on HIV. Let's learn, let's look, let's listen.
Hello everyone, welcome to Remedies. I'm Dr. Asma Qureshi. Today I will talk about HIV. You may have heard about HIV and AIDS, and you may also know that the disease can be transmitted from the infected person to another person. Currently, there is no cure for HIV, but scientists are trying to develop a vaccine for the disease. However, HIV can be controlled with medication. The goal of treatment is to reduce the severity of the infection and prevent the patient from transmitting infection to other people. HIV refers to human immunodeficiency virus, and AIDS refers to acquired immunodeficiency syndrome. AIDS is the most advanced stage of HIV infection. As the HIV virus grows in the body, it destroys immune cells called CD4 cells, so the body can no longer fight infections and cancers. When the immune system becomes weak, there is an increased risk of getting opportunistic infections, for example, pneumonia, diarrhea, thrush, and cold sores. TB and cancers, which are called AIDS-defining conditions, occur more often or more severely when a person has HIV infection. Many people don't even suspect that they have HIV infection until they develop an opportunistic infection. So what should you do if you have tested positive for HIV but you don't feel sick? A blood test will show a decrease in CD4 levels, an increase in the amount of virus in the body, known as viral load. Doctors will use this test to develop a management plan, monitor the effectiveness of treatment, and to assess whether HIV infection is progressing to AIDS. You will need to start treatment as soon as possible and take antiretroviral medicines every day as prescribed, regardless of the amount of HIV virus in the body. Pregnant women should also get tested for HIV and start treatment immediately to prevent the transmission of HIV to the baby. Breastfeeding is not recommended because HIV can be transmitted to the baby through breast milk. Talking with a health worker provides an opportunity to ask questions in a confidential manner about any concerns you may have regarding your ability to continue treatment. For example, health insurance, medication reminders, side effects, possible drug interactions, infant feeding, and alcohol. Experts recommend that you should take more than 90% of your pills correctly to achieve the best viral load results. Inconsistent use of medication will increase the chance of developing drug resistance and treatment failure. When this happens, doctors will adjust your treatment based on resistance testing. Sometimes infected immune cells stop producing new virus and go into a resting state, which is called latent state. In the latent state, viral loads are low and HIV medicines don't work. You must be wondering, then why not just stop the medication? It's important to continue taking the medication because the purpose is to prevent the viral load from increasing when the virus starts multiplying again, and to prevent a drop in CD4 cells. In this way, medication will reduce the chance of developing opportunistic infections, improve the quality of life, and make it possible for you to enjoy a longer, healthier life. Often people worry about getting infection from an HIV-positive individual through casual contact. Studies have shown that if a person is taking medication exactly as prescribed, then hugging, shaking hands, sharing toilets, or sharing dishes with someone who is HIV positive does not increase the risk of getting HIV. For more accurate information, check www.cdc.gov/HIV risk. Remember that a viral load is detected by a blood test. A blood test cannot measure the amount of HIV in the genital fluids, so it is still possible to get HIV from a partner or spouse. What are some remedies for people living with HIV? A healthy diet and exercise are very important for maintaining the immune system. Experts recommend that people living with HIV should wash their hands with soap and water before eating and after touching raw fish, poultry, or meat. They should wash all fruits and vegetables before eating and thoroughly cook eggs, meat, and fish. They should drink filtered water and high-calorie protein shakes. They should talk to the doctor about immunizations, travel precautions, taking multivitamins, doing aerobic exercise, and maintaining their body weight. If you are HIV positive and don't have an appetite, then eat small meals and drink protein shakes every day. When you have diarrhea, drink Ensure and eat rice, bread, or applesauce. If you are pregnant and have nausea or vomiting, sit for about 30 minutes after your meals and eat small, frequent meals. Drink ginger tea or ginger ale and don't brush your teeth immediately after eating. Ask your doctor for a referral to a registered dietitian if you continue to experience challenges with your diet. If you're a parent of a child with HIV, you already know that nutrition is an important part of the treatment plan. It's important to understand that HIV infection increases the risk of getting heart disease, diabetes, and micronutrient deficiency. HIV medicines often cause a shortage of nutrients in the body, so you may need high-potency multivitamins to complement your diet. Antioxidants are very important too, because they can slow the virus and repair the damage caused by the disease. Supplements that are commonly prescribed include B vitamins, vitamin D, antioxidants like vitamins A, C, and E, as well as calcium, magnesium, selenium, and zinc. I hope this information was useful for you. Thank you for watching. I'm Dr. Asma Qureshi. Please join me again next month for a very interesting episode of Remedies.